And, but then as I explored further, there was a dural tear over on that side. And then there was a bunch of bone graft material, which was from the bone bank. And it's in a putty form. And I removed the putty, and it wasn't in an appropriate spot for it. It was in a spot called the foramen, which is the space between the two levels of the spine, which is where the nerve root comes out at each level. So I very carefully removed this putty-like material, granular putty-like material. And then I started looking for the nerve root, and there's no nerve root. There's no L5 nerve root. And then distally, I couldn't find it. And then I went up proximally where it comes out of the spinal canal or spinal sac. And I did find the blunted trunk of the L5 nerve root. So he had cut the nerve root in order to make room for the bone graft, which didn't belong there. There was also no evidence that he tried to enter into the disc space, which was the whole point of the operation, which was to take out the disc between the two bony vertebral bodies and place an implant. Well, he had never found the disc to remove it. So anyway, it was really grossly inadequate surgery. And I think multiple times during the recording, I said, because I had read his operative report previously. His operative report was pristine. It was detailed, pristine, orderly, and appropriate, very correct for every step. And so it was not that at least mentally he didn't know how to do the procedure. He certainly didn't know how to do it with his hands. And I stated it was like he took every step of the procedure and did it wrong.
I think that's a really important point because, you spine surgeons, you have a formula and a way of dictating your operative reports. And there are things that you're dictating because they're important. And detailing the procedure, any complications that you encountered, things of that nature. So the disconnect between the way he dictated the way the surgery should have been done, it was like you're saying, he knew this is the way the surgery should proceed.